How old are you?
28.
And how long have you had back pain for?
Since I was 21, so going on 7 years now.
Okay.
Yes.
Hi, my name is Adrian Miranda, and I'm a physical therapist on a quest to find the cure for lower back pain. I'm going to start by educating the public and challenging the healthcare system. Did you know that you are more likely to suffer longer from back pain if you are dissatisfied with your job? Did you also know that you are less likely to suffer from back pain if you have a bachelor's degree or higher? The United States spends billions of dollars a year on low back pain. In an article in Reuters, it was estimated that low back pain cost the U.S. $85 billion, rivaling cancer, which is about $89 billion. So, if the United States wants to save a couple bucks, why not work on the economic burden of low back pain? Join me as we try to unravel the challenge of low back pain in the U.S.
Lucy works all day, but all of her debt is here to stay with the child on its way.
They don't exercise and they bend the wrong way.
I hear a lot about people like lifting from their back instead of their knees, or I would wonder if maybe hereditary sort of things would bother that.
Imagine just lifestyle and genetics.
Not enough exercise is frequently a problem. Lifting?
Yeah.
A lot of heavy lifting. They sleep around for a while, a long time.
Because they just don't know how to take care of themselves.
So tell me when did this all start? How did it all start? Give me the story.
Well, the story is, I always prided myself on being the only one in the family who never had any back pains. We had a family chiropractor who would always come over, and I would always joke around with him, oh, I don't have anything for you this time. In college, I was playing rugby during my junior year, and it's a very physical sport. And I started developing some hip pain, just tightness, and I was like, I think I'm finally going to go see, the doctor who comes over to our home now and then to take care of the rest of my family, and proceeded to see him, now and then. And one day he did a series of adjustments involving my lower back that he felt was necessary, and there was one adjustment that he did that I just felt like something was wrong, something changed. It was a very strange sensation. Afterward, he asked me to get up, walk around, thought that everything should be better, much looser. And I remember just feeling detached, like, there was just a clear separation from my lower back. I didn't feel quite as stable as I had my entire life. Later that night, my lower back area completely inflamed. I couldn't even stand up straight. I was doubled over in pain, very swollen. Called the doctor, said, he said that should not have happened for the kind of adjustment that I did. Let's, get some x-rays. So went in and got x-rays, and, his assessment was that I had some kind of an anomalous disc my entire life, but that whatever adjustment he did, which would not have had that effect on a quote normal person's back, had an adverse effect on mine. So from that day on, off and on, it would become aggravated if I would move the wrong way. I noticed that hyperextending or hypoextending would cause, the inflammation again, and that seemed to just be a constant, occasional pattern. Not every day of my life, but I definitely notice now that things I would be doing, sports, just movements in my everyday would now all of a sudden have an adverse effect.
So why do people get back pain?
Well, there's a variety of reasons that people get low back pain. Of course, nearly everybody knows that people get herniated discs in the spine. A lot of people will get back pain from some specific injury like falling on their back, on the ice, or on the stairs, and that initiates low back pain. Or people get back pain from work. All sorts of things will cause low back pain. The single most common cause of chronic low back pain is a dysfunction at the sacral joints. And I found when people have an acute disc herniation, they have a sacral joint problem, which they probably had at times in the past, and they may not have noticed. A little pain here and there, they forget about it, and now that probably caused a twist of the spine, irritating that disc, causing the herniation over a long period of time.
Well, the biggest thing that is that everybody knows, you should bend your knees when you pick up something heavy, right? So the problem with that's correct, but then a lot of people then arch their back. Okay, that's the biggest thing that I see. When you arch your back, the ligaments and the muscles are in the weakest position they can be. So by simply arching your back like this, right? But I bend my knees, my back is okay. That's how you throw it back out. Okay. Notice people become this lower back dominant. Everything they do, they move from the lower back. Right? When they stand up, they move too much from the lower back. Right. When they reach their hand like this, they tend to arch their back. Everything is very lower back dominant. The biggest thing is that people don't understand that the body is great at healing itself. Great. So if the body is really great at healing itself, but you keep doing things to damage it during the day, you're a constant battle at oneself. They treat it like such a different type of breed and animal. It's very simple. If somebody came in and sprained their ankle, right? When you sprain your ankle, you twist your ankle like this. And everybody knows this, well, I just don't do this and I'll get better. Very simple. I'm gonna take it easy, won't run. And most people with ankle sprains, they're pretty much fine on their own, right? However, the thing with lower back pain, it is not as transparent. What motions should I avoid? Should I avoid this? Should I avoid that? Should I avoid that? And if you don't know what motions to avoid, very simply, you'll constantly damage yourself on a daily basis.
That's a big question, and there's many etiologies of back pain. I would say, you can get it from an acute injury. Something happened and you got an injury, and then you get like back pain because your body can't recover very well. I would say big portion of the people get it from muscle weaknesses and muscle imbalances, and then resorting on the lower back muscles, doing the effort that other muscles like the core should make to prevent back, to keep a good posture. Hours of sitting down without exercising the core, people that work standing up, not wearing good shoes. From a Chinese medicine perspective, certain patterns and conditions will produce lower back pain. For example, being in the cold with your uncovered back. It's difficult to pinpoint exactly which one, but I would say all of the above.
People get back pain because they're injured, because they get old. It's going to happen to all of us. And, also kind of repetitive exposure. So when you're doing the same movements over and over and over again, you open yourself up to back pain in the same way that someone might open themselves up to carpal tunnel syndrome. So movements in your back ultimately can lead to back pain. I've practiced workers' compensation law probably about 6-7 years at this point, and I represented insurance companies. So some of the larger insurance companies that you can think of, I defended them in workers' compensation claims. And as you can imagine, a lot of the claims were back claims.
Is a snapshot of what you see in the anatomy, but it doesn't tell you where the pain is.
Have you had an MRI?
Yes.
What did the doctors tell you, or what was your diagnosis, or what did it show?
So I recently had an MRI because after going to therapy for so long, you know, the question was still in my mind, do I have a herniation? And so I had a conversation with my chiropractor, and he said, you know, there is a chance that you could have one, but he also explained to me that a lot of people, you know, with back pain or without back pain could have one as well. That it's, I guess, more common than people think. And that the reality is, what he explained to me is that even if you have one, there's nothing that really can be done or that you should do differently than what you're doing now, which is being active, going to therapy. So he said, you can have one if it will give you some kind of peace of mind. And I said, you know, I just want to know. It's just that comfort of knowing what's going on with you. So I had one. So I met with the physiatrist to go over the results. And honestly, even from that was a little unclear. I felt like the doctor was a little hesitant to say any one thing conclusively about what it was that's causing the pain. You know, he said, oh yeah, it looks like, you know, something could be hitting some nerve endings down there from some slight protrusions, but you know, he said he couldn't conclude that that was what's causing all the issues down there, that it could be a variety of things, you know, also the fact that my spine, the erosion that had initially come up from the initial x-ray, that you know, compression of the spine could be causing the pain as well.
There was a study some years ago, in the beginnings of MRI. They did an MRI on a small group of people, like 25 or 50, and then 10 years later they did another MRI, and they found that in half these people their herniations had gone away, and in half they hadn't. There was no correlation between having a herniation and having pain still.
No, the standard protocol, if meds don't work, then I'm going to send you for x-ray. And, you know, x-rays rarely show you anything when it comes to lower back pain. And so then the next thing is MRI. And MRIs are very, very expensive. But once again, you know, there's tons of studies that show that MRIs don't really reveal anything useful when it comes to lower back pain.
I think imaging is super important. I think we can still treat people without imaging, but, you know, I think if we have the possibility and, you know, the more information the better. However, just because you see a protrusion, meaning a bulge in the disc, or you even see as much as a disc herniation, sometimes you can even see stenosis, like a reduction of the space, that doesn't mean that what you're seeing is generating the pain. And there was a study in football players where I would say maybe, I think 50% had these herniations, and most of them were asymptomatic, 18-year-old.
The problem is that people want a quick fix. You know, sometimes it doesn't take a couple of sessions, or 5 sessions. If you have lower back pain for 10 years, it's 10 years or 2 years of you doing something incorrectly. It's going to take a bit. So it requires some patience and some personal ownership on people, unfortunately. In our society, we become so addicted to quick responses, quick results. Everything's quick. But this is one facet that you won't get quick responses. Because you see a lot of stuff advertised on TV for quick responses for lower back pain. It's very short-lived.
The final cutting solution, this is my favorite one, is a bumpy ball. These are not just attractive for decorations in your home. This is actually, I think you would argue, the single most important thing you can do every single day to relieve back pain. Now, there's something called the open book. What is that?
And then the second exercise in this is you're going to open your leg, and then you pull the knees together first. And what that's going to work is those deep intrinsic muscles on the bottom of your pelvis called the obturator internus.
Well, that task force in general is very conservative, and they're not going to make a statement that something is useful or not unless they feel there's good evidence, no matter how it seems reasonable. Like they recently decided, and they published this, that breastfeeding is useful. I kid you not.
Huh, well, where do you start with such a statement? Well, I could go many different ways. The biggest problem is that when you look at any research, right? Lower back pain research is like one of the worst out there, bar none. Because what they do, any person with lower back pain, they take them, they throw them to a study. You have lower back pain for 2 weeks, for a month, for a year. They don't care. Because the thing is with lower back pain, there's 10,000 different causes, whether it's a muscle, a fascia, this joint or that joint. So what they do is they take everybody, put them in a group, and then they give them one intervention that might be appropriate for a muscle problem, but not for a joint problem or whatever, and they kind of group them together. And that's what happens. They group them together, not trying to figure out what is the cause of each person's lower back pain, and they give them a universal treatment. So of course, it's not going to work, okay? And it's ludicrous that they continue to use the same type of methodology over and over again, and just further confusing the public.
I unfortunately will have to disagree. I mean, I know it's a task force and that's an opinion against this whole thing. I don't know how the study was done, but I would say, you know, my personal evidence and other articles that I have read and other colleagues that we have talked about, and, you know, some pain conferences in pain and, you know, in preventing pain. I mean, there's a lot of evidence for. Sometimes clinical research, unfortunately, has to be taken with a grain of salt, you know. So without, I mean, that sounds like probably like a meta-analysis, or as you say, they checked all these articles. Maybe I have to read more. I don't know. I am a bit surprised. And I don't know exactly how to explain their conclusions. I don't know exactly what they read, you know.
No. No. Okay. General practitioner. You know, unless you say something, they're not going to ask you about it.
Not really.
No. I don't believe so.
I don't think so. I think that's probably a pretty not silly question, but I think it's probably assumed that people that are 30 and under don't have it, you know? So no, I don't think she's ever asked me that.
No. Yeah. Ooh, I got pain.
Well, no. If I tell him, you know,
right.
Because I'm on screen for it all day. You know, like, why not? If you have something to tell me whether I am prone to back pain or whether in the next 5 years it looks like I'm going to have back pain, right, then let me know.
Well, I think the schools are always the most important places. I think the new generations are always the most important thing to educate.
It starts from school, right? There should be a base. You know, there should really be a basic class in school that talks about how to take care of your body.
Ain't one thing wrong. I'm young and free. I got my whole damn life.
That's what needs to be done with the population, to teach them a different truth.
Okay. On any other level, would you take these resources?
Boy, if I had resources that were unlimited, as a third step, I'd teach physicians. But that's the hardest thing to do.
Why?
Because physicians really don't listen very well.
Why?
Because they're trained not to listen well. They're trained that they should learn certain things, and there's so much to learn that they learn that, and they're taught to listen to their teachers. And when they inquire, to inquire within that framework. And it's very hard, I think, for a physician to learn to think outside the box.
Would you have any ideas of how to change that thought process, that make a paradigm shift?
Oh, I'm not confident to say that. That's really hard.
Like, that's what the crux of your research is?
That's the crux of this film. For example, is that scurvy, 1600s, 1700s, was killing tons of sailors out at sea. One doctor came up saying that, oh, you need to eat more vitamin C, because all these foods were high in salt and stuff like that. There was one fleet that gave vitamin C to their sailors, and they did a lot better than the other sailors who didn't. There was no research yet, but guess what? Everybody adopted it, and it wasn't until it became commonplace to give vitamin C to sailors to treat scurvy. Research came out like 10 years after it became commonplace. It was about at least a century, maybe longer than that, that they were using it to treat scurvy. So the whole point is, why do we have to wait for research to come out in an epidemic that costs the U.S. about $80 to $90 billion a year in low back pain, workers' compensation claims, poor quality of life, you name it. So why do we have to wait for research to come out to prevent low back pain? Do you ever think you'll get to a point where you'll resolve your back pain?
No. In fact, I'm scared about down the line how it might feel. It just makes me think it's going to get worse as I get older. But, you know, I refuse to ever be immobile, and I know how to manage it as best as I can and as best as I've been told for now. But it's still there. It's never going to go away completely, I don't think.
We'll bring down costs because our medical bills shouldn't be based on the number of tests ordered or days spent in the hospital. They should be based on the quality of care that our seniors receive.
So, do you think primary care physicians should screen patients in their yearly physical for low back pain?
That would be nice.